Good afternoon, Addie and Isabella. I'm your doctor, Dr. Ali. I understand you both have questions about how vaccines before deciding whether to receive one. I'd be happy to discuss the benefits, risks, and how vaccines work with you.
Thanks, doctor. I'm not against vaccines. I just want to understand them better. How exactly does a vaccine prevent me from getting sick?
Great question. According to the CDC, vaccines contain antigens, which are weak, inactive, or harmless pieces of a virus or bacteria. These antigens stimulate your immune system without causing the disease itself. Your immune cells recognize the antigen as foreign and begin building a defense against it. The World Health Organization also reports that vaccines are one of the most effective public health tools for preventing infectious diseases.
So my body thinks it's fighting a real infection?
Exactly. Specialized cells called antigen-presenting cells process the antigen and display it to helper T cells. The helper T cells activate B cells, which produce antibodies, and cytotoxic T cells, which can destroy infected cells. Most importantly, memory B and T cells are created. If you're exposed to the real disease later, your immune system responds much faster and more effectively. When your body encounters an antigen for the first time, it produces a primary immune response, which is slower. After vaccination, though, memory cells are created, so if you're exposed again, your body produces a secondary immune response that is much faster and stronger.
But wouldn't it be better to just get the disease naturally? Wouldn't the body learn to fight it all on its own?
Natural infection can create immunity, which is called active immunity. However, it comes with the risk of getting the disease itself, which can lead to hospitalization, long-term complications, or even death. Vaccines provide vaccine-induced active immunity, at the same time reduce those risks. The goal is to gain protection without getting the disease.
I've heard about active immunity before, but what about passive immunity?
Active immunity occurs when your own immune system produces antibodies and memory cells after getting an infection or vaccine. Passive immunity happens when antibodies are received from another source. This is just like how babies receive antibodies from their mothers during pregnancy, and certain antibody treatments can provide immediate protection. Passive immunity works quickly but doesn't last very long because memory cells aren't produced.
I've heard vaccines contain harmful ingredients and can cause serious health problems.
Vaccines, just like any medical treatment, can have side effects. Most are mild, like soreness at the injection site, fatigue, or low fever. Serious side effects are possible but extremely rare. Before approval, vaccines go through multiple phases of clinical trials, and monitoring continues after approval. Scientists and public health agencies continually evaluate vaccine safety data.
So there are risks, but they usually are small compared to the disease itself.
That's correct. Every medical decision involves weighing risks and benefits. For most people, the benefits of preventing serious disease greatly outweighs the risks of vaccination.
What about the people who still get sick after being vaccinated? Doesn't that mean the vaccines don't work?
No, a vaccine is not 100% effective. However, vaccines highly reduce the risk of severe illness, hospitalization, and death. Even if a vaccinated person becomes infected, their immune system is usually much better prepared to fight the disease because of immune memory.
That makes sense. Vaccines basically give my immune system practice run before the real thing happens.
That's a perfect way to think about it.
I still have concerns, but I understand the science better now.
Asking questions is so important. Making informed decisions requires understanding both the evidence and the biology behind vaccines.
Thank you, doctor. I feel more confident about how vaccines work now.
You're welcome. The goal is to always help patients to make informed decisions based on scientific evidence.